beautiful day, isn't it?
The Big Show on Kiss 92.
Good morning, good morning.
It is a beautiful day, especially beautiful when we have Dr. Martha Lee, our sexologist, in the studio. Good morning,
Good morning.
Dr.
Morning,
Martha
everyone.
Tara Lee.
Hey, I just
Morning,
realized
everyone.
what happened to that wonderful intro that
Yeah.
I produced just for our sexiologist.
Oh, that's right. We do have a special
Sorry, I forgot to put it in.
intro.
Let me put it in right. Put it in.
Okay. One more
Okay.
time.
All right. Let's go.
Are you ready to get sexy?
Welcome, Dr. Martha Lee,
Oh, yeah.
the sexyologist.
Sexy and I know it.
On a scale of 1 to 10, how sexy are you feeling this morning, Dr.
10.
Martha Lee?
Yeah.
It's
All
important to
right.
feel sexy, right? It's very, very important. So
It all
every day,
starts with the mind.
everyone wakes up, you feel sexy, it'll be a great day.
How can people feel sexy as soon as they wake up? I mean,
Tell
like,
themselves they're sexy.
oh, okay, that's easy enough.
Dance in front of the mirror,
Dancing
naked.
helps.
Yeah, no, I mean, surely you look at yourself in the mirror naked every day, right? I mean, once you go into the bathroom, you're going to take a shower, you see yourself.
Yeah, but some people don't like the way they look. You know what I mean? In the mirror.
Music
so.
helps. I feel like if
that's
you have
true.
a good, sexy sounding song, it helps you feel sexy too. Like, I'm bringing sexy back.
I like Marvin Gaye for sexy.
Learn to like how you look. How about that? Okay, so Dr. Martha Tara Lee, what are we talking about today? I hear it's something to do with prostate cancer?
Yes, let's talk about prostate cancer and everything around it today because this month is Prostate Cancer Awareness Month. And also they coin November as Movember, which is a time to highlight prostate cancer, testicular cancer, and also mental health for men.
So
Alright,
it's
so
basically for the men.
it's more than just growing out your mustache during
Of
November,
course,
right?
yeah. It's like women have breast cancer month in October. You guys have today is also International Men's Day, so everything kind of is coming together as well.
Yes, it's International Men's Day.
I like how your voice went lower because it's International Men's Day. We know you're a guy.
So, so are you gonna teach us what to do to prevent prostate cancer or what?
Yes, one of the ways you can prevent is to be healthier, exercise, try to watch your weight, cut down your smoking or cut out your smoking, less red meat, saturated fats. But I think
Don't drink too much.
Yes.
Yeah.
I think
The
a lot of
usual.
people associate it with ejaculation because there are statistics that says that regular ejaculation that's helped to reduce the risk of prostate cancer. I think this is especially so for men in their 30s. If they can masturbate, okay, there's a statistic on it, 21 times a month, then you reduce the chance by 31%. That's quite
so
significant.
3
Right.
weeks out of the month. Okay.
Yeah, but I don't think this is for all ages. I think it's the preventive aspect of it when you're younger.
And I
Right.
think the stats are quite high when it comes to prostate cancer in Singapore.
Yes,
right?
it's-
You know why? Because the men are all not having sex.
That's one
because their
risk.
wives are all not having sex
I
with
feel
them.
the blame is going on the women again.
So, in other words, ladies, you are responsible
Oh my
for our
gosh.
prostate
You,
health.
you love your husbands, you need to,
Yes, give and
give
take.
him what he
and take.
needs.
Yes.
And it also starts from the other side also.
Correct. Give and take. I like that.
What?
Yes.
Nothing.
So 1 in 6 men are actually being diagnosed with prostate cancer in Singapore. And contrary to a lot of fears around it, actually only 1 in 6 could potentially die from it. So if you diagnose it early, then the chances of you being able to die with prostate cancer versus from it is much, much higher. So there's a very high survivorship of more than 90%.
Okay.
All right.
Wow.
Let's continue to talk to Dr. Martha Lee on the Big Show TV. Meantime, here's Itzy with Untouchable on Kiss 92.
So we talk about 1 in 6. That's quite a high number.
Yes,
Right,
that's
I mean,
quite
you
high.
think about it. You just walk into your office or walk into a family gathering. You're like, oh my gosh, 1 in 6 of us may have prostate cancer, right? So I guess the question is, how do they spot it? What are the symptoms?
The thing about this is usually there's no symptoms.
Oh.
There are no symptoms usually, but some of them would include peeing more often, cannot pee fully, feeling that your pee is weak, you start to have like stop-start, you start to have more urination at night, aching is one of the signs, trouble with your erection. So this actually is also not just for prostate cancer. You can also have these same symptoms if you have prostate enlargement, which I was so surprised actually will be very, very likely to happen to almost all men as long as they've lived long enough. They are very likely to have this. So prostate enlargement is actually very common. So you do need to go for examination to be able to assess your risk because you don't really know. And the problem in Singapore is that surprisingly, it is actually very low rate of detection early. So 15% of them are actually being diagnosed at stage 1 versus 20 years ago, which is at 60%. So from 60, it came to 15 now.
Yeah.
So something in the 20 years, people are actually getting diagnosed slower.
Less.
Yeah.
Yeah. So
Okay.
men are what's happening? Men are not going in quick enough, or
Yeah, I think they are not aware. They may just think this is a sign of aging. So they are not aware that from the age of 50 or 55, depending of whether you have family history, you should actually go for regular screening.
What do you mean not
Okay.
going in quick enough? Men
getting it
always want to
checked.
go,
Yeah.
like, you know.
Stop it! I'm talking about getting checked.
Oh,
But on that note, though, how often or how frequently or how regularly should men be going for prostate exams? And what exactly does a prostate exam entail?
Yes. So digital rectal examination.
In
So
other words,
it-
they stick your finger in the.
No,
in the
digital,
through the anus.
Digital, yeah.
Yes, digital.
not the finger.
Yes. finger.
I don't-
Finger.
She is,
Finger?
yeah, when she's
Yes.
talking about
Digit.
digits.
Oh,
Yes.
digit, not
yeah.
like a
Women won't know this,
thermometer. No, of course not. Yeah.
Okay, so it sounds very uncomfortable.
Uncomfortable. Yeah, and then being penetrated by a man. However, I learned that you can't just ask anybody to do it for you. The doctors have been trained to detect the signs, including roughness or like the prostate being like very hard and lumpy. They check the right side, the left side to compare. So there's a very, very specific techniques that not just anybody does.
Stick a
this.
finger in and feel
That's
it
probably
around.
why
yeah.
guys are not going. I mean,
Yeah.
that
Yeah,
doesn't
it's
sound like a very
uncomfortable.
appealing.
However, the whole process just takes less than 10 seconds.
You know what? Women feel the same when it comes to pap smears as well. It's not exactly the most comfortable examination as
But
well.
it can save your life.
Exactly. I mean, we still have to do it, you know?
Yes, so besides the digital examination, there's also the PSA test, which actually just is a blood test.
Oh,
Okay.
That one is a bit
sounds
more
much better.
accurate.
I'd rather do that.
But yeah, it's more accurate? You said?
Usually they do the digital first,
Oh.
and then if they have any suspicion, they do the PSA. But I would say the PSA would be the next level, and I would think it's more accurate.
If you can save your life,
Yeah.
you know?
And how often? Once a year?
Yeah, you can go once a year from the age of 50 onwards. You can go to polyclinic, you can go to GP.
So what do you ask for? You say you want a prostate check examination. Is that what it is?
Yes, yes.
Okay. As simple as that.
any
As simple as that.
any hospital
Polyclinic. She said polyclinics as
Polyclinic,
well. Yeah.
Or GP.
Or
yes.
GPs.
Oh,
Oh, what? GPs are qualified to do prostate checks?
Yeah, they are qualified.
Oh.
you mean
But
you go
if-
to the clinic and they'll do it there in the clinic?
Yeah.
I thought you need to go to a hospital to do something
For a
like that.
specialist, right?
Yeah.
Yeah, if you want to, you can. However, you can just ask.
Yeah,
I suppose
preferably-
if they're not qualified, they'll refer you to someone who
Okay.
is. They're not just going to do it for the sake of doing it.
I was going to say, preferably find someone with small hands.
Oh, you'll survive. Come on.
Small hands, your prostate will seem even bigger then.
Okay.
Okay,
Okay.
there are a lot of treatments when it comes to any suspicion of prostate cancer. There's active surveillance because most people are actually diagnosed at early stage. They just need to monitor. Then when it's localized, meaning the prostate itself is affected, then you may want to go for radiation or surgery. And if it's more advanced, then you may want to go for chemotherapy, targeted therapy, hormone therapy. So there are actually a lot of treatments available and options that can be weighed with the doctor.
So your GP will be able to tell you if you have an enlarged prostate.
Yes.
He's probably going to refer you to a specialist,
specialist,
then, right
yeah.
after,
Tests,
right?
for more
Because an
tests.
enlarged prostate does not necessarily mean you have prostate cancer.
Correct.
Yes.
Because it's so common, the enlarged prostate, and it's benign. It's not cancer.
Do we know what causes the enlargement of prostate?
Aging.
Hawker food, nah.
Aging.
Oh, okay, aging.
So all men are going to get hit by enlarged prostate?
Yes.
Well,
So when you're in your 50, you have a 50% chance of having this BPH, which is benign prostatic hyperplasia.
so half of men will get
Yes.
enlarged
And
prostate.
Yeah,
when
because
you're
by
in
the
your
time you're 50, most husbands will not be having much sex already.
Yeah, I was going to say abstinence is another reason, right?
Maybe.
Is abstinence
No,
a reason?
no. I mean, it has a preventive effect, but we never know for sure.
Oh,
But abstinence from what though?
Sex.
Abstinence from sex is different from just abstaining from even masturbation.
Masturbation.
yeah.
You know what I mean?
Okay.
So what I think Dr. Martha Lee is saying is that release is important.
And if
Right.
you don't ejaculate, then your body will find a way to release for you, like in your wet dreams.
Oh, okay.
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 In your dreams,
Nocturnal
literally. All right.
emissions.
Okay. I thought
Okay.
only like teenagers get wet dreams.
No.
Dr. Martha?
I have clients who don't masturbate, don't touch themselves because when they were growing up, they were told don't touch yourself, it's bad, it's sinful. So they ejaculate in their sleep, wet dreams.
Oh my God.
I also have met a handful of people who actually do not touch themselves but just masturbate through thinking.
Oh.
So like thinking off.
What?
And they can climax just like that.
when they're
That's-
conscious?
Yes.
That's
yes.
how deprived they are.
Wow.
Don't touch.
Right? So I mean it's
Not-
correct
not
when I say
deprived.
yeah, I mean if
I
they're not
also-
getting it anywhere.
Wait, let the expert speak,
Yeah,
please.
but also I also think that it's time, space, circumstances, and choice. Some people they don't have confidence with dating, or they cannot find a partner, or they are socially awkward. So there are many reasons why people don't have partners.
Okay.
It sounds like a party trick
Yeah.
almost. I don't mean to make light out of it, but I mean, I didn't know that could happen.
Swinging to a different vein, though, could this lead to things like premature ejaculation because you have not climaxed in such a long time? You're so repressed
With your person as well.
Yeah, that you just can't hold it in or last as long.
Yeah, I have a lot of clients with all kinds of challenges around their sexuality. There's premature ejaculation, delayed ejaculation, erectile difficulties. So let's say if they are a quick masturbator or they are used to masturbating in a certain way, and then when they want to have partnered sex, there may be some difficulties, like they are not comfortable with the position, the angle, the speed, the
And it
rhythm.
takes time to kind of like get used to one person, especially, right?
Yes, the comfort with someone, because actually when you're with someone, you can feel very vulnerable, exposed.
I'm telling you, the
and,
more sex you
nervous.
have, the better. That's the
Right?
thing.
Practice makes perfect, right?
Confidence goes up. You're like, anyway, we're going back on air.
Kiss 92 traffic.
Lots of peak hour traffic on all the usual highways, but if you're on the PIE heading west towards Tuas after Clementi Road, look out for a vehicle having trouble there. If you spot anything else, 8855-0920.
Good morning and welcome back to The Big Show and The Big Show TV. We are live on Facebook as well as YouTube right now. Our guest for this morning is Dr. Martha Tara Lee, our sexologist right here on The Big Show. Welcome back, Martha.
Thank you. Thanks for having me.
And we're talking about prostate cancer, okay? And I'd be remiss if I didn't ask, how does prostate cancer affect your sex life or even intimacy? Because, I mean, aside from the physical challenges you will face in having an active sex life, I'm sure psychologically as well, someone who's going through something like prostate cancer, hard to stay in the mood or feel sexy.
Yes, definitely. So a lot of people, once they are diagnosed with cancer, whatever type of cancer, they are being told their options for treatment, and they basically go into firefighting mode. And a lot of times, unfortunately, in our public system, they don't have enough time to have fully informed information around the side effects, including on their sexuality. So for people who go through prostate treatment, a lot of them, 40 to 70% of them, actually develop difficulties with their erection. And every single client that I've worked with cancer, they all have issues around their sex drive or libido. So the treatments causes their body to go into shock, firefighting, and represses their hormones and therefore their sex drive. Some of them, if they go to prostate treatment, they may develop a urinary incontinence, which means like difficulty to control their bowel movement.
So you said with prostate enlargement, more men are at risk of experiencing that, right? Like up to 50%. Does this affect also the sex life?
Yes,
of
definitely.
those with?
Yeah, if you have embarrassment around possible leaking, or you have concern about whether you feel like peeing during sex and all that, you just have discomfort around that region, you may start avoiding sex.
What about pain? Do men experience pain?
Yes, you may experience pain as well. So one of the cancer survivors that I was listening to in a webinar actually said that they were experiencing aches and pains, and they just associated with muscle aches because of a lot of exercise. So things like that, are little signs that sometimes you don't even know. So like I mentioned, there are no symptoms. So it's better to get checked, especially since this is November.
But do they get pain, I'm sorry to go so detailed, inside the body, or is it in the sex tool?
Yes. So the pain can happen around the hip region or lower back. Yes.
Yeah.
Okay.
Would you confuse this as maybe I got a hernia, maybe I overworked a muscle when I was at the gym?
Or a back pain or whatever it is,
or
right?
indigestion, right?
Oh, indigestion as well. Okay. That's what it feels like.
Lower part.
How you know
Okay.
you don't have a prostate?
I don't know.
She's spoken to enough people.
You're a doctor and you've done.
and done my research.
You've done your
but
research.
the point is, it's so scary because it can have no symptoms as well.
Yeah.
Okay.
You know what the sad thing is? The sad thing is, and I've heard stories like this before, where initially the husband doesn't have anything wrong with the prostate, but as years go by, maybe enlarged prostate, maybe they come down with prostate cancer or whatever, and during that time they're not having any action with their wives, and as you mentioned, that could possibly be one of the reasons why they get enlarged prostates, because they decide, okay, I'm just going to abstain right now. As long as my wife is not in the mood, does not feel connected with me or whatever, it's fine. And then the person comes down with prostate cancer, and then suddenly the wife wants to have sex. That is the irritating thing. What do you say?
Yes, I think sometimes
So
we have.
I think you should be talking to the women, because there's so many men who are listening in right now who want to make love to their wives, but their wives don't want to make love to them.
Okay, no, I totally agree. Let's talk to the women because I have a question.
Okay. Oh, are we live now?
Yes, we
Oh
are,
my
yeah.
goodness, I wanted to bring that up on the Big Show TV actually. Anyway, we'll continue to talk to Dr. Martha Lee on the Big Show TV. The time is 8:24.
Kiss 92 Time Check brought to you.
So I was actually going to go on, down that route, not exactly in the way that Glenn did, but for the women in the lives of the men who may have an enlarged prostate or prostate cancer, how can the women, I'm going to represent them, be more sensitive to the men during this period, or have sex during this period? How can we make it more comfortable for them?
It's too late.
Oh, stop it. You see, I'm trying to be nice. Stop it.
I think what happens with a lot of people going through cancer is their spouse, their partners will usually leave them alone and be very supportive through the process. And when they start to notice things happening to their body, changes, they start to withdraw even further because things are not functioning the way it used to. There's also atrophy of the penis, which is the reason why
that sounds terrible.
sexual rehabilitation is important. So some of my clients, the ones that I've heard of going to private practice, they are actually given ED drugs like Viagra to help them to maintain the erection, because the blood flow still needs to happen as they are going through their treatment. So a lot of them do not know that ED drugs actually helps with the continued functioning of the penis, so that recovery can be faster.
It's not gonna-
okay. All right. Okay.
It's not going to clash with any of the medication that
Yeah.
they're going to be taking to treat the condition, is it?
Yeah, so because they are taking other things,
Yeah.
so sometimes what they do is they just forget about this thing. But actually, it's important to understand and be under medical advice. But usually, yes, it's not contraindicative. It doesn't affect.
I think that's rare because once a guy comes down with like prostate cancer and all that, he won't feel so sexy anymore.
Yeah.
You know
That's what
I
I'm
mean?
saying.
And it's going to be the last thing on his mind, wanting to have sex.
That's what I'm saying for women or for their partners or for family members. How can we make it more comfortable for them? And, because women get cancer as well. Knock on wood, breast cancer, you get your boobs chopped off and whatnot, what have you, right? So women go through it as well. So men are kind of expected to be there and make them feel sexy and all that. But how can we do it for the men?
Lingerie.
I think it's also the same
Will that
thing.
help? I mean...
Yeah, but it's also the same thing, right? Being supportive, cooking their favorite food, giving them time, hugs and kiss and validation.
Yeah, but it's too late. Because
It's not because of a lack of sex only.
Mainly, I can tell you
Is
that
it mainly?
is that. Poor thing. All I know of many guys
I know.
who just need that but are not getting it.
Okay,
Poor thing.
However, also better late than never.
Hell hath no fury,
Yeah.
like Glenn's going.
Later
Okay.
we go into a case study. I think you will enjoy this case study. Somebody actually sent in a question for Dr. Lee.
Okay.
But before we get into that, earlier on we talked about some of the things you can do to lower the chances, the probability of coming down with things like an enlarged prostate or prostate cancer. Let's talk about treatment and recovery. Okay, what are the stages? Because I'm sure there are a lot of people, even once they come down with this condition, it's very scary, the thought of what they're going to have to go through. What are some of the treatment and recovery options?
Yeah, so there are many treatment options. There is active surveillance, like doing nothing, just monitoring. There's nerve sparing. There's radiation if it's localized, meaning just the prostate. And then there's hormone therapy, chemotherapy, targeted therapy, because there are so many options, it's good to weigh them with your doctors, because I'm just saying in general, but also like different drugs will have different effects as well.
Okay. I want to talk about something that we have here in your notes. We've spoken about Movember. We've spoken about Prostate Cancer Awareness Month and all that. What about No Nut November? This is a thing that has been going around that urges men to abstain from ejaculation for 30 days. That doesn't sound healthy. And is it something that we're encouraging?
If I want to be like that, I might as well have been a priest.
Yes.
Okay, so it actually started in 2011 as an internet joke, No Nut November, because of the rhyming effect of it. But there's actually no evidence. In fact, the challenge of No Nut November is don't ejaculate for 30 days. There is no evidence that it helps you with your testosterone, discipline, prostate health. In fact, it distorts healthy sexuality and affects the body's way of regulating itself.
Yeah.
So, by that rationale, then, would you say that something like, say, tantric sex is bad for you? Because based on my understanding, Sting, right?
Yeah.
Apparently he practices this, right? Where, he can experience an orgasm without the physical climax and ejaculation.
I think the difference between No Nut November or the No Fap movement is that you just abstain, you do not do anything.
Yeah, you do not
whereas with
ejaculate.
tantric sex is that you still feel the
Release.
Emotions and
sensation.
release.
You still feel the sensation, meaning you go through the stimulation, but you just choose not to ejaculate, and there are specific techniques of regulating the sensation through your body.
Yep.
So it's actually telling the body what to do. So you're actually moving the energy in your body, but choosing not to ejaculate.
Sounds powerful.
Tantric sex, there's no ejaculation.
They try not to. It doesn't mean that it doesn't happen, as in like accidents, but it is actually more the intentionality behind it.
And
is-
it's all self, right?
Yeah.
It's no
So
physicality
you can do
with
it
someone.
with yourself, you can do it with a partner.
But it cannot
Tantric
be
sex.
healthy. I personally feel like if there's no ejaculation, if there's no release, then it's not healthy.
But that's not the aim of tantric
so
sex.
what happens with a lot of people, there's also this belief that you are dependent on the ejaculation, because that is definitely a peak.
The
But
goal,
instead
yeah.
of going for that big peak, you go for basically like slow and steady kind of excitement. So it's more the arousal. So instead of the destination is the journey. So enjoying all of it, because once they ejaculate,
Journey over.
There's the energy dip. So
Like
that's-
having 6 small meals a day, that kind of thing.
Well, I guess if you want to put it that way.
yes.
I mean,
something
which
like
one
that.
leaves you more satisfied, fuller?
So there's a good description here actually about tantric sex, but it will also talk about conventional sex, right? It says unlike conventional sex, which often has a linear start to finish script ending in climax, tantric sex prioritizes the journey. So it's about the whole journey. Orgasm may or may not happen, and delaying it or edging it is a common technique to prolong pleasure and build energy. Sounds very powerful.
So aging has a lot to do with stop-start. So it's like you start and then you stop,
pull
but
back,
you pull back when you are close to ejaculating.
Right.
So that if you finally do have an ejaculation, is really big.
So much more, yeah.
However, the emphasis more is like not ejaculating.
This is like a fantasy, you know. Most women don't want it to go for too long either. I can tell you that right now.
It's because it's painful.
Exactly.
There's dryness. However, it also depends a lot on how you're feeling, like your libido. You know, like a lot of women have different
Or who the partner
periods
you're
of
with
the
is, yeah.
month where they do feel more horny.
Yes, that's true.
And also because, we've got lives, jobs. You've got
Children.
stuff to do, right? Can't spend a million years.
I mean,
Well, I can tell you that women would like it to last longer than the men last most of the time. So
wow, you see?
Sorry,
No,
not,
but I'm
Champion.
speaking
not,
from-
not all of us can be Johnny
Champion.
Sins now, okay?
Champion. I tell you, the women talk damn big, no? Some women.
Yeah, so it,
Really?
it is a bit like when you're so engrossed in something, you lose sense of time and space. Like hours go by and you don't even realize. So that's like the meditative effect of tantric sex.
Yeah. Try to get the women to do the work that the men have to do, in a session. After a while, it's like, hey, 30 seconds, you're tired already.
I think it's mutual. It's like thinking of it as a sprint versus a marathon.
Right.
So if you know you're going for a long time, then you will pace yourself and you really can enjoy the pleasure and the sensation rather than focus on the ejaculation.
I'll let
Which
Dr.
is-
Martha do the talking.
It's why it's
from here on.
important, bro, for both parties to 做工, to do
Yeah.
work.
Yes.
Cannot just be
It's
one-sided.
reciprocal.
Well, yeah.
Yeah.
It depends. Most women have no stamina.
Some guys have no stamina.
Correct.
Thank you, Dr.
So for those guys,
They
Work
should
on
be-
it.
Bet lah.
So
Right.
for the guys that have no stamina and for the women who have no stamina, they should find themselves in lives. And for those that do versus those that do, may they also find themselves.
well, exactly.
You know?
Yes.
But I mean, every time we talk about like people having sex, we talk about like doing it for a long time. It's like 15 to 20 minutes is more than enough. Am I right, Dr. Martha Lee?
According to
No, I mean,
Yeah,
look,
according to who?
yeah. It depends. It changes
That's how
between
long
people,
Glenn-
right?
Glenn
Clearly.
lasts.
well, I'm not ashamed to say.
Yeah,
15
that's
to
okay.
20 minutes, well done.
That's it's a good.
Perfect.
That's
I think that's
perfect
a good
spot.
number.
Okay,
That's
I
a
think
good
you're
one.
talking about the
And it-
duration of penetration.
And it depends whom, right? I mean, if like two people, let's say,
But how
married
about
for
all the-
many, many years, it's
How
going
about-
to take a long time.
Let- let
probably.
us
How
be
about all
honest.
the other things before
The
penetration?
foreplay and everything.
That
Yeah, yeah,
all
yeah.
Can we count dinner as part of the process? Because that's part of the...
no. I think
No.
post dinner. Let's go
Okay.
safely because dinner can go on for 4 hours.
Okay.
My message here today to couples, to married couples, because usually the wives talk really big. One moment they don't want, and then the husband wants it all the time, and then, the husband stops asking, and then eventually when the husband asks, then the wife will say like, oh, but you
Too
did not
late.
initiate. It's like excuses. Women make excuses all the time. Oh no, wives make excuses.
Someone
all
please
the
come
time.
along, marry Glenn and give him what he
Look,
needs.
I'm speaking up for all the husbands who are being deprived.
Glenn needs intervention.
The great songs in one place. Kiss 92. Kiss 92 traffic.
On the AYE towards the MCE at the Corporation Road entrance, look out for an accident. Other than that, heavy traffic all over the place wherever you are today. Stay safe.
Welcome back to The Big Show and The Big Show TV. It's Glenn, Angel, and Tim with Dr. Martha Lee, our sexologist. And today, I am trying to champion all my brothers out there, husbands who are being deprived, who are being starved. in terms of sex by their wives.
Glenn Ong helping men get
Of
some.
course. I want.
It is International Men's Day, so there needs to be a superhero out there.
Yes,
Yes.
champion Glenn.
Correct.
And of course, the month of November, it's also about championing some very good causes. Today we're talking about prostate cancer. Dr. Martha Lee, what do you wish more men knew about prostate cancer?
That is not a death sentence for sure. And to get screened from 50 and above, you can go to GP polyclinics. That you should have sexual rehabilitation early, and there are places that you can go to, like Singapore Cancer Society, to get the support, whether it's physical rehabilitation, emotional support, or sex support from me. So yes, I'm also the sexologist at Singapore Cancer Society.
Right. But what do you say, like, for someone who has like prostate cancer right now, and in his mind he's thinking one la barbecue la.
What?
Yeah, what? Don't understand.
He's thinking it's the end
你
of
不
the
会讲
road.
华语啊？
我听不懂，我听不懂你在讲什么。完了。
Alright,
Okay, so I do want
没有
to say,
救了。
I do want to say that a lot of us, because of our conditioning programming, they think that when they don't have an erection, if they have erection difficulties, you don't have an erection, so you cannot ejaculate. And people think because I cannot ejaculate, I cannot have an orgasm. But just now what we mentioned about tantric orgasm is that actually you can still have the sensation, pleasure, you can still have an orgasm, but maybe you're not ejaculating, and maybe you do not have erection even. So a lot of my clients get so confused with that because they have been having sex in a certain way, so they cannot think laterally. And then the grief comes in, which is like they just want things the way it was.
Yeah, I was actually going to bring that up about orgasms and and ejaculations, because they're not the same thing, especially for men, right?
They're not the same thing, but there are people who are used to doing things in a certain way, and even when I explain it to them, they do not understand what I'm trying to say. You
Okay.
still can have pleasure even if you don't have an erection.
Right.
And even you don't have an erection, it doesn't mean you cannot have orgasm.
Right.
And sometimes with surgery, the ejaculation is retrograde ejaculation, where the ejaculation goes back into the body, into the bladder, and may come out in your pee. And so they think there's nothing, everything is gone, because they have come to associate the release with a physical release. They can actually see the ejaculation.
And that is equated to the orgasm, which it is
Yes.
not.
And since you mentioned the word come, can I just ask you, why is it so hard for women to come?
They need time to feel safe. They need time for the arousal to build, and before it's really their turn or their time, then it's over. So even you can say 10-20 minutes, but or 15-20 minutes, that's how long Glenn lasts. He was telling us.
Okay.
Even then, what about the build up? So sex is so much more than penetration. There's
Yeah.
also all the other stuff around it.
No, I'm into foreplay and all that, definitely. But based on experience, I know that there are some women who can come more easily than others. So,
And I think it's all about getting to that point in a woman's body
right.
that allows her to get to that place.
Some
You know what I
women
mean?
some women know their positions.
Some women know their positions, yes, and some women don't.
Yeah, and
Their
some,
sweet spot.
Yes.
Their
exactly.
G spot.
Yeah.
But
And
it
it's
is-
either by penetration or sometimes it's oral sex.
So it's just like how some Olympians are able to do peak performance, and then there are other people who struggle with certain sports. So sex is something that actually, with more connection with your body, it does get easier.
Okay. Let's continue to talk to Dr. Martha Lee about sex, because she is the sexologist anyway. On the Big Show TV. Meantime, here's David Archuleta with Creme Brulee on Kiss 92.
Okay, we still have to get to our case study, but one more question I just thought of, right, before we get to the case study. Earlier on, we were talking about lack of ejaculation, lack of orgasms, problems in bed, as maybe a warning sign. Okay, volume of ejaculate. Is that also
10 cc.
yeah? Maybe you don't release quite as much as you used to release in the past. Is that also a warning sign?
No.
No.
That's
No?
not a warning sign. I think it can reduce as you get older. And I think there are people who associate the volume with satisfaction.
And the volume with manhood, which is not equal, right?
Yes, it doesn't have to be that way. So I think we need to debunk a lot of these myths.
Okay. Case study.
But you know, I mean,
Oh,
look,
good.
if the guy, let's say, is having sex and then, all of a sudden, he doesn't have as much, coming out, it's probably because he's been playing with himself for the past few days.
Is that true?
It's true.
Is it?
Or is this an age
Yeah,
thing?
let's say if you play with yourself, like, okay, five times a week, and then you have sex on the sixth day.
Yeah,
let's say,
yeah.
You won't come quite as much.
I don't know if it's a storage
Look.
thing or if it rejuvenates every
No,
day.
it
I have no
rejuvenates,
idea.
yes.
Yeah.
Of course it does rejuvenate.
Every
but,
day or-
But
yeah.
as opposed to, let's say, if you abstain from sex, let's say you have sex once a week,
Yeah,
right? You're not
and
playing with
then
yourself. You will
it's
have
Niagara Falls.
You will have enough. I wouldn't say Niagara Falls,
Dr. Lee?
but there will be enough. But if you were like ejaculating every single day, and then you're on the sixth day, you actually have sex with someone, chances are, you won't
Have
come
as
quite
much.
as much.
Yeah.
But production
the
and
pleasure
age
will still
are
be there,
linked.
but yeah. Sorry, go ahead.
Sorry. Are the volume and age, they're linked as well?
Yeah, they are linked. There are things that you can do to make sure that you are healthier, like sleep, exercise, diet, pelvic floor exercises can help. But I think it's about being realistic as you get older, because there are aging signs, and a lot of my clients, they are actually not able to accept it.
Right.
They want to behave the way they did in their 20s
yeah.
just because they want it.
Well, in order to do that, then you need to have more sex. That's the thing.
Exercise.
I feel like it's got nothing to do. I mean, age. If an older person is unhealthy, that's where all the problems happen. But when if you're healthy, everything will be fine.
But there's also a question, is more really better? If you are ejaculating for the sake of ejaculating, if you're masturbating because you are bored, you're not really listening to whether your body needs it, whether you're really horny. And so that can affect your pelvic floor. Your body could be tired. Your penis could actually be desensitized because you are actually being too rough with yourself. So I always tell my clients, listen to your body. I'm not against masturbation. I'm not against sex. But the reality is a lot of them are actually doing it because they are bored, because it's a habit, because they want to sleep better.
No, which is why I don't think I'm not encouraging people to like play with themselves five times a week. I was just giving you an example
Yeah.
But it does
of
happen.
how much.
Yeah.
But I mean, too much masturbation obviously is a problem as well. You can get addicted to it.
Yeah.
I mean, who doesn't like being with someone? I think all of us love being with someone, but not all guys can get that. And maybe not all women can get that as well.
Let's talk about this message that came through, Tim.
Sure. Okay. I think you will approve of this person's
Who
message.
is you?
Okay?
Me?
Who is
Yes.
you?
Glenn,
Glenn,
because
okay.
I mean, this person, his message reflects a lot of what Glenn's concerns are as well. Okay, now anonymous, we'll keep you anonymous. This person texted in. I'm going to give you the condensed version. Okay, he says his 10-year marriage is struggling due to a severe decline in intimacy since the first baby arrived. Now, sex frequency plummeted from weekly to bi-monthly, despite the fact that the husband, who's in his mid-40s, multiple efforts to initiate and feel desired. But the wife, who is in her early 40s, states she simply lacks the mood or horniness. She performs sex just to fulfill her role. And this makes the guy feel rejected. It makes him feel unwanted and unsexy, noting that their infrequent encounters are robotic and unfulfilling. Before they had the baby, they had a very active sex life. Now he finds more satisfaction in masturbation.
Oh, that's sad. But can I just say something?
nothing
No,
yet.
never mind. Can I just say something first? Okay? You got to give your wife some credit here because at least she's putting in that effort. Some wives don't even put in that effort and, they just forget about it altogether. But from what I hear, at least the wife is trying. It's, mechanical now, but she is
Something
still,
is better than
she's
nothing.
still
lah,
trying.
huh?
Yeah.
Now, while they communicate well, because we have spoken about the importance of communicating, right? They communicate well on all other aspects, like their kids, their home, their future. The sexual frustration, now he uses this word, is killing him as the husband. What advice would you give?
Also, what's the real reason she doesn't want to have sex?
Yeah, since they're communicating,
Yes.
right?
Okay, so what happens is a lot of women actually need longer time than people think to get back that sense of self. I have learned that it can be 1 year, it can be 2 years. And then after that, maybe what happens is they get busy with the kids and then this habit sets in. So they need time to find out what is it that they need to feel loved and supported, and not just that, but actually feel nourished from the relationship. I think they get into mommy's role, and sometimes they really neglect themselves, so they don't have any more energy for anything other than doing the bare necessities.
Can I just say, like, for men, I mean, in a situation like this, I'm not giving an excuse for anyone, but this is what it's like if you've just had a child and you're looking after that kid. Man wants to have sex, and you are, in a dirty shirt, you've got puke, you've got breast milk, you've got your hair in a mess, whatever it is, and husband's like, you know what, I'm feeling sexy right now. For the woman, even though she might want to, she needs to go have a shower, she needs to clean up, she wants to put her face on, she wants to get her hair done, and by that time, that whole mood has gone already. Do you know what I mean? For whoever, or by the time she gets ready and is ready for the man, baby is crying. Baby needs to be fed. Diaper needs to be changed. So there's a lot of things that go around that. I'm speaking from a mother's role. But as Glenn said, it is nice enough that he is getting some.
Yep.
I don't think husband can say it's mechanical, because when the husband is ready, girl needs to be ready to go as well. And at that time she's like, okay, let's do this efficiently before the child wakes up or before kid comes back from school.
So this is your choice that you choose to masturbate because it gives you more satisfaction. But what I'm saying here is that you need to give your wife some credit, because there are wives out there who will not even consider or bother giving it to you.
And she needs more time.
Okay.
She needs a little bit more time, I feel.
So making time for her to feel that she is not a machine and sex is not robotic is one of the keys as well. So blocking out time to connect, to talk to her, to actually have the time penciled down for intimacy is very important, because if the house is messy, if certain things are not in order, if the kid is next door, like all these things can affect her.
And look, I mean, for married couples, this is what marriage is.
Yep.
You stay loyal, you stay faithful to each other.
That's important.
You have to put in the work. It's not for everyone. Like if I use myself as an example, I know for a fact that I'm not cut out to be with just one woman. I cannot.
Fair enough.
And that's the reason why I've been divorced 3 times.
Yeah.
And I'm just being really honest here.
And you're just discovering it now.
Exactly.
After all that time.
Yeah, and now I'm really, really clear, right? And I mean, I'm happy, I'm single, I'm free.
He's taking care of his prostate.
Absolutely.
And if you have consent from all parties, why not?
Yeah, everyone knows where you stand and where they stand, then it's good to go.
Yeah, marriage is hard. And having a healthy sex life while you're married is also hard.
Yeah.
Both parties have to put in that effort.
Yeah.
Okay, we're going back on air. Hilary Duff with Mature right here on Kiss 92. All the great songs in one place. Our guest for this morning is Dr. Martha Tara Lee. Got a question from one of...
Anonymous.
Someone... Yeah, anonymous. Okay, so this person is asking this question, right? He's in this marriage and they're not having, physical intimacy anymore.
Since they had the baby.
But I mean, no, it's another
different.
one.
Sorry.
This is a different one. Yeah, so... this person is asking you what he should be doing because he wants to be intimate with his wife, but his wife just doesn't want to be intimate with him. So he's left with very little options because she's just absolutely not interested in sex anymore. What is he to do?
Yes, so when you're in a marriage, you do want to be monogamous. You do not want to cheat on your partner. A lot of them actually really, really love their partner and want only intimacy with them. So it is understandable, the loneliness. So instead of blaming them, shaming them, scolding them, nagging at them, yelling at them, I think it's really important to actually say things that speaks to the heart, such as, I really, really miss being close to you. Like, I think these things will work so much better, and let's talk about what can help, and maybe list down all the possible ideas, and try implementing some of these things, like blocking out time, going on dates, talking about their lives in a deeper way, and having babysitter.
Yeah.
What I notice about a lot of parents is they are time pressed, and therefore they do not want to sacrifice any single moment without their child if they're free.
Yeah.
So that's the parents' guilt as well.
Yeah. We have a question from Adrian on Facebook. He's saying after TURP, and TURP is TURP, transurethral resection of the prostate. He says after TURP, you do not ejaculate semen. Is it okay that the semen still stays inside your body? And does the TURP lead to premature ejaculation?
Wow.
Yeah.
Not
Do
even
you
heard
know?
of that
Yeah,
term.
neither have I. Do you know
what
about
happens?
this?
What happens is, just now I mentioned, sometimes there are cases of retrograde ejaculation where the ejaculation actually goes back into the body and into the bladder. And there are people who say, oh, I don't know where it went, all my semen, I don't know where it went. It could have gone back into the bladder, but actually come out through your body in the form of pee. So actually the body may release that as well.
Is that safe?
Yeah, it's all right.
It's all right. Okay.
So
As long as
I
it's safe.
think the focus is on the pleasure rather than on anything else.
Okay.
Right.
Good advice.
Okay. We've run out of time. Anything before you go, Dr.
yes,
Martha Lee, what's coming up and all?
I think people need to know that it is useful to go for support, to be part of a community, to exchange notes, to exercise together. So at Cancer Society, we have support groups, Walnut Warriors. I love the name because the prostate is the size of a walnut under the bladder. It looks exactly like a walnut. So yes,
Because when
we have...
it's enlarged, then it becomes the size of like maybe an orange or something.
Not quite.
Okay.
But yes, so there's physical rehab, sexual rehabilitation by me, and then emotional support. So yes, check out singaporecancersociety.org.sg.
I think instead of enlarged prostate, you just change the name to angry prostate.
Yeah.
Angry and
it is
inflamed.
angry.
Like pissed off prostate.
Okay.
Okay.
POP. It's a pop.
All right.
Okay, thank you so much, Dr. Martha Lee, for coming
Thank
in.
you.
Always a pleasure. We'll see you next week, okay?
Thank you. Yes.